So tell me a little bit about how the recent partnership with Illumina and Philips is helping to solve the problem that Navican is trying to solve.
We have cancer in the community, and it's a global challenge. Those two factors allowed us to consider and to answer the question of how do we get to these patients? How do we have impact on these patients relative to therapy and outcome? And while Navican with Intermountain has a lot to offer, we are not solving this problem by ourselves or on ourselves. We have to partner with large, very successful organizations who bring their distinct skill set to the table so that we can make out of something that's currently pretty fragmented and make a turnkey solution out of it. Because at the end of the day, a community oncologist, how many patients does a community oncologist sees on a daily basis?
Anywhere from 20 to 25 patients a day, which is a really busy clinic schedule, and those patients require your full time and attention.
Yeah. So what about us taking care of this problem? About what is precision medicine? Does it work? How should I do it? How do I get the therapy to the patient? What about the payer? Show me the data so that I can make that a sustainable pathway rather than an exception. And I feel with the partnership with Philips and Illumina, we have two very strong partners who share the vision and the mission to improve patient lives while bringing distinct strength to the table relative to Illumina's leading technology in oncology sequencing. Philips, with their ability to provide us the IT solution to be fully implemented in a local physician's EMR, so that Intermountain's best practice is at the fingertips and day-to-day work of a community oncologist. Too high of a goal?
It's the right goal.
It's the right goal.
Implementing precision medicine for cancer patients is a field that's still developing, and so the typical community oncologist out there that's focused on his or her patients shouldn't have to spend time worrying about all of these other steps. Precision medicine is a multi-step process that includes obtaining sample, testing that sample, interpreting the results, procuring drug. In the past, until now, each of those steps has been handled by different commercial entities, and it's been quite fragmented. Partnering with Illumina, partnering with Philips, and letting Navican lead the way is how you can make that a seamless end-to-end solution, so that the practicing oncologist that's busy doesn't have to worry about, well, when I get a test result, how do I interpret this? How do I get the drug? Just let Navican do all of it, and you can worry about treating patients.
Lincoln in a box.
That's what you want to do, is you want to deliver precision care to cancer patients so that they can feel well and spend time with their loved ones.
So one thing you mentioned was the end-to-end process. Why is that important to patients?
Patients also don't want to see fragmentation and be confused about what's happening to their sample. How can they get access to cutting-edge care? If you're a patient being seen not at an academic medical center, you're worried about what about all of this cutting-edge technology I hear about at the major centers? And as a patient in the community, maybe you don't have the ability to travel to those faraway places. So having an end-to-end solution is a way for patients to feel like, I'm getting access to cutting-edge technology, I'm getting access to sophisticated interpretation by experts in the field of genomics and precision cancer medicine. And this entity, this process is going to help me get the drug too. It's not just going to end with a report. So the patients are really who benefit the most from this.
Yeah, an end-to-end solution to
that's right.
have the physician having time to focus on the patient.
Right.
And to have the patient to spend time with family and the loved ones, because time is precious. If you are a metastatic cancer patient, we are not in a situation to cure cancer as a society, but we at least can provide more time and hopefully also more quality of life for these patients and their families. And that's what gets me out of the bed in the morning and make me very energized about what we are trusted with as being part of Intermountain. And thank you for your support and inspiration and insights. And as a team, it takes more than one. It is really a team effort, and we at Navican are grateful to be basically in this amazing company with Intermountain to impact patients in the United States, but also worldwide.